I'm going to give you my take on the science, the clinical experience. For those of you who doesn't know me, I know most of you. I'm Steven Liew. I'm a plastic surgeon for the last 22 years. My clinic is 1 minute away there. We have a surgical and non-surgical clinic. I'm also based at St. Vincent's Private Hospital and St. Vincent's Clinic. I chose the title, Wound Healing, the New Disruptor, is here for a reason. This is not an exaggeration. I think this is something that you hear more and more and more. And I decided to collaborate because of what I've seen, but also the story. Many a time you see all this breakthrough is come from bigger countries overseas. And whenever you have something like that come from a small little company, it's something that I want to be associated with and something I want to be assist so that we can bring it to the global scale. And why wound healing, you wonder, because a lot of you come from the beauty industry, right? Like wound healing, man, you know, why are we talking about bed sore? Why are we talking about this for a while? And there's a reason. I think all of us in this room at some stage would have some sort of cut, some sort of wound. It's part of our life, right? You're lucky enough you haven't not seen it. Probably happened to your kids. Little Johnny come back, they have this cut, tiny little burns and all this stuff. We've all seen it. And these were the type of thing I still see because, you know, I know the patient, they say, hey, listen, can you have a look? So that's how I got associated with it. As a plastic surgeon, this is what we do, right? We inflicted wound and injury on the day-to-day basis. One, some sort of surgical, and the other one's from a CO2 laser. There are still wounds that I have to deal with. Granted, one is created by me, and the other one is created by accident. And sometimes wound does not heal up perfectly. This is after a facelift for someone who smoked. So now, you know, while you're enjoying it, I want to ask, what do you do when you have a little cuts at home? We all have a special remedy. Some of you might go to chemist's warehouse to buy something. We've all been through it before, and sometimes you look at it and say, which one do I pick, right? And you ask the chemist, and unfortunately, chemist is probably the worst person to ask because they don't see the after effect. They just read out what the company is telling you. So chances are you have actually used betadine some stage of your life. And if you're more progressive, and you might use this thing called solugel or hydrogel, and cost a fair bit. And then, you know, you might have a burn, you go to chemist's warehouse, they'll say, hey, one of these is good, and you just didn't know what to pick, and you look at the pricing, you look at this thing, oh, this comes from Switzerland, sounds pretty good, I'll buy it, right? And that's how it works for majority of individuals. And for us, you know, a steroid strip is our bread and butter. So, to date, in the last 25 to 30 years, don't get me wrong, we make a lot of progress. To date, all the wound healing management is what I call a passive wound healing. That's it. There's nothing wrong with passive wound healing, and the philosophy is if you provide a suitable moist environment, the wound will tend to heal on its own accord. But that philosophy works very well. In the past, we used to expose the wound to the sun to dry it all out. We know moist environment is what we need. And we have made a lot of progress. These concepts arose 30 years ago. All the dressing we have now is trying to promote that moist environment. It works to a certain extent. But there are still times that the wound does not heal for a variety of reasons. You're not healthy. You know, the wound is probably not suitable for type of dressings. And that's so passive. We tend to say, hey, do that, it will hopefully work. I think 30 years is long enough. If we're still using the same thing, there's not going to be progress. We are here because we want progress. We are a progressive nature type of individual. The whole world, we're talking about, particularly medical world, we talk about regenerative properties. In surgery, in non-surgery. What does that truly mean? It's very complex. Just think of it that way, right? In our human body, we have cells floating around. We have this thing called ECM, extracellular matrix. Think of it as a three-dimensional meshwork of structural scaffolding. In there, it allows cells to sit properly, supporting it, but also create an environment for cells to talk to each other, right? Whenever there's an injury, cells talk to each other to generate that signal for it to heal. But if you have a regenerative injectable, things like your fat grafting, it creates stem cell extra signaling so that the whole environment becomes supercharged to heal, to create more blood vessels, better, healthy, useful tissue. That's the whole concept of regenerative medicine, and the whole world's going that way. With that, I want to actually talk about the new concept that rather than just rely on passive, we should all be thinking about active wound healing. Proactively, whenever you have a cut, you use something to supercharge the environment so that it will heal faster, better, and more optimal. Chronic wound takes a huge burden to the society. Our tax dollar all gone there. Patient bedbound because of chronic wound. They're in pain, they're smelly. It takes a lot of effort. And it just slows the human population down. And that is why we need something that is active wound healing. So that's why I put down the news disruptor, because it is here. It just so happened to happen in our backyard. And this is what it looks like. Come in a white box. It's a new standard in aftercare, and Tony has mentioned the company's name is Tissue Repair. And this product is TGA approved for wound healing, and hopefully at some stage it'll be FDA and the rest of the world. The basic ingredient is pretty simple. You guys probably have used it in skincare product, beta-glucan, right? And the proprietary of this in tissue repair is glucoprime. And our next few speakers, scientists, are going to talk about it. They are scientists. It's called glucoprime and how they process it, right? So what if I tell you the basic ingredient, glucoprimes, come from the yeast, baker's yeast. That's it. It's pretty cheap. And that's why this product is very affordable, because a good product does not have to cost you an arm and a leg. This is a natural ingredient we see. I can't even pronounce it. Okay, Saccharomyces cerevisiae. Perfect. Right? Yeah, that's what it is. Sounds very, very fancy, because this is what we're dealing with. Right? That's what yeast looks like in a microscope. And that's what it looks like underneath it. It's a growing organism, budding. We like to get that beta-glucan from the wall of that product. So in order to have a carrier, they have a hydrogel, which is the one that creates the moist environment. But now we supercharge that moist environment with something we have a regenerative property, the glucoprime from TR Pro from the yeast. And this is what it looks like. One of the wound, we'll clean it up, we just apply that and we'll cover it. So, why baker's yeast? Because apparently it's got this beautiful beta-1,3 and beta-1,6 side chain. I'm not a scientist, he can explain to you. But that's the reason why that was chosen. And clearly there's a lot more. You need all this machinery. You need the beta-glucan to be in a certain size. It has to be a big enough molecule, particulate, in order to create that regenerative property to stimulate that local immune system for it to heal. And you need to create a highly powerful sterile for us to use it in our day-to-day wound. You just open it up, you use it. And that's how you mix it with hydrogel and you get the TR Pro. So what happens if you cut yourself? What happens if any one of you have a tiny little burn? We all go through the same process, right? All wound healing go through 4 stages. I'm not going to bore you. You have first stage, that's why you always have a bleeding. And bleeding is important to stop the bleeding. The next important stage is inflammation. Remember this word, macrophage and neutrophil, that is your white cell. It needs to get in there to get rid of the clots. It needs to get in there to get rid of any of the contamination, the bacteria, the dirt and all this stuff. It basically chews them up. From there, it signals other stage called the proliferation. That's where all the blood vessels starting to grow in, all the collagen, all the elastin to create a healthy scar, right? And then you have those remodeling. The whole process This take instantly. This take 3 to 7 days. This can take up to about 3 to 4 weeks. This will be take to 6 months. Every single wound goes through it, right? So when any of these stage, particularly this stage, it get prolonged, that's when healing process get disrupted, right? So just remember, macrophage, we mentioned a lot, are the king. Think of it as a conductor in wound healing. That macrophage will signal what cell they want to grow in. That's why macrophage, the king, the glucoprime act on the macrophage. So it acts on the macrophages, and you supercharge that macrophages so that the macrophages can actually do its job as a conductor to say, you need to come in now, come in faster. You need to stop doing this bit so that we can actually move on to the stages and shorten time the wound healing. So this is what happened. The green is the tissue repair, the beta-glucan, right? It gets, once you apply it, it goes through the cell because macrophages sit in the bottom of the skin, and then starting to get taken up by the macrophages at 2 hours, at 8 hours, it's supercharged, it pumped with it. It's almost like that macrophage on steroid, ready to signal things that's going to start healing. That's why we call it regenerative, because it starts signaling other things, right? So it's starting to get all this, surrounding area excited to actually start healing. So this particular lady, a bowl of boiling water, just happened to see me limping with a lot of dressings, reluctantly agreed to let me take it out. That's day 9 after the burn. She spent a lot of money on those dressings that you have seen, pretty bulky. I call it day 0 because I clean it up and just apply the wound there. At day 9, which is close to after 2 weeks, it's already healed. Those wounds normally take up to 3 weeks. In a nice environment, it will close up in about 10 days or 2 weeks, but not healing to that level, right? And if you look at it at a month since TR Pro, it's almost fairly robust, that she doesn't need any protection anymore. She's not concerned about the redness, any of those. It's thickened up so much. That is what I like about TR Pro, something so simple. You just clean it up, apply because it's sterile, and you cover it with some occlusive dressing. You don't have to change it every day if you don't have to, right? So remember what I said, glucoprime is a large molecule, and if you have a small one, it doesn't seem to work that well. It doesn't activate the macrophages, and that's why, I guess it's trademark or registered glucoprime. Not all glucoprime the same. As I said, a lot of the skin, a lot of the gel that you use are beta-glucan, but it doesn't seem to what they've compared to work the same way. So you need something of a particulate size to create those ones. This is an important study. Once again, it's done in Australia. It's done in South Australia. So they look at some mice to create a standardized wound and applied hydrogel, your common variety dressing on one, and TR Pro, which is glucoprime plus hydrogel. Look at the size difference. And the next slide is day 3. Look at the blue. The wound's a lot smaller. And if you look at 1 week, it's significantly smaller. If you look at that photos, you can see the difference in terms of wound healing. So in day 7, there's a 37% reduction in the size of the wound. So hopefully, I think this is part of the trial that they're trying to get the FDA to actually approve it in America. Fingers crossed. So these are the things that a lot of practitioners in Australia, surgeons, dermatologists, cosmetic physicians, we can't use that word anymore apparently, and nurses have used it on their day-to-day thing. Some of them are for medical indications, right? The next one is what we tend to do. Any type of machinery we use to disrupt the skin for better, younger, more youthful skin or wrinkle, we create an injury. It's a control injury, but we still want to heal it. You can see 18 hours before and after. This is not the best lighting, I'm sorry, to actually see it. it's not bright enough to see. You can actually see one is still red, one is less red, and the marking is almost gone. If you look at this one on the needling between right and left, you will know which side is being treated with TR Pro. And the last slide, skin needling more fierce, and skin needling showing the progression. So I like to be associated because the result you're seeing is clinically proven. There's a lot of science, there's a lot of investment financially because it costs a lot of money. I can't remember how many millions you can spend. It's TGA approved, it's affordable, right? It's made locally. And for me, this is probably the most exciting part because we are now moving to the phase of active wound healing rather than she'll be right, leave it up there, you know? Just something active. It has regenerative property, affordable, and TGA approved. Thank you very much.
Thank you.